Have you ever been on your period and thought, wait, is that smell normal? Maybe you changed your pad, took a shower, and still felt a little self-conscious about it. Or maybe you noticed that your period smells different from one month to the next and had absolutely no idea why. If any of that sounds familiar, you are not alone, and honestly, you came to exactly the right place. My name is Gig Nurse, and I'm a health educator. And today we are going to talk about period smells, what causes them, what's completely normal, what the different types of odors actually mean, and when you might want to check in with a doctor. No shame here, no weirdness. Just real helpful information that every person who gets a period deserves to know. Let's get into it. So first things first, why does period blood have any smell at all? Here's the thing that a lot of people don't realize. Period blood isn't just blood. What comes out during your period is actually a mix of blood, uterine lining tissue, vaginal fluids, and the naturally occurring bacteria that live in your vagina. And when that whole combination exits your body and hits the air, a reaction happens. The blood begins to break down, the bacteria interact with it, and that process creates an odor. That is completely, 100% normal biology. There's also something interesting happening with your body's chemistry during your period that affects how things smell. Your vagina is naturally quite acidic. Its pH typically sits somewhere between 3.8 and 4.5, which is a healthy range that helps protect against infections. But blood has a much higher pH, closer to 7.4. So when menstrual blood mixes with your vaginal environment, it temporarily shifts that pH balance. And that shift, it can change the smell. Once your period ends, the pH returns to normal, and the smell usually settles right back down with it. Now here's what's interesting. A lot of people are genuinely worried that other people can smell their period. And that fear is so understandable. But here is the reassuring truth. Period odors are generally not noticeable to other people. The smell happens when menstrual fluid is exposed to air and bacteria, and it tends to stay close to the body. You are much more aware of it than anyone around you is. So take a breath, because you are almost certainly in the clear. Let's talk about the specific types of smells you might notice, because they can actually tell you a lot about what's going on. The most common period smell is a metallic or coppery scent, kind of like a copper coin. This is totally normal. It comes from the iron content in your blood. You might notice it more on your heavier flow days when there's more fresh blood present. It can also be slightly more intense if you're dehydrated, because dehydration concentrates everything. So if you notice a more pronounced metallic smell, drink some water first. That's often all it takes. The second type of smell people commonly notice is earthy or musky. This one tends to happen when menstrual blood has had a chance to sit for a little while and starts reacting with the natural bacteria in your vaginal area. It's not an infection smell, it's more of an aged smell, and it usually means it's time to change your pad, tampon, period underwear, or menstrual cup. This smell is your body's little reminder that it's time for a fresh product. Staying on top of changing your period products every few hours makes a big difference here. Some people also notice a slightly sweet smell, which can happen when menstrual blood mixes with cervical mucus. Again, not a cause for concern. It just reflects what your body is putting out at different stages of your cycle. Now let's talk about the smells that are worth paying attention to. A strong, rotten, or foul smell is something to take seriously. In most cases, this happens when a tampon has been left in for too long. And yes, this happens more often than you'd think. It's easy to forget, especially toward the lighter days of your period. If you've been wearing a tampon and suddenly notice a really strong, unpleasant odor, that's your body telling you something. Check that you've removed your last tampon. If you can't find the string, please see a doctor as soon as possible. A retained tampon can cause a serious infection, so don't wait on that one. The smell you really want to watch out for is a strong, fishy odor. Now, here's what's important to understand. A very mild fishy scent can occasionally happen during a period, and that's not necessarily alarming. But a persistent, strong fishy smell, especially one that comes with other symptoms, is usually a sign that something needs attention. The most common culprit is bacterial vaginosis, or BV. BV happens when the balance of bacteria in your vagina shifts and certain bacteria overgrow. It's actually one of the most common vaginal conditions, so if you have it, you are absolutely not alone. A fishy smell from BV is often accompanied by a thin, grayish, or white discharge. It can also be associated with an STI called trichomoniasis. Both BV and trichomoniasis are treatable, but they do need to be diagnosed and treated by a doctor. So if you're noticing a strong fishy smell along with any unusual discharge, itching, or burning, make an appointment. There's no reason to feel embarrassed about it. These are incredibly common conditions, and doctors see them constantly. Let's also talk about a few factors that can affect how your period smells from cycle to cycle, because a lot of people don't realize how many things are at play here. Your hormones are a big one. Estrogen and progesterone levels shift throughout your cycle, and those shifts can affect your vaginal pH and discharge, which changes the smell. That's why your period might smell slightly different month to month, even when everything is perfectly healthy. Stress is another factor. When you're stressed, your body activates its sweat glands, including the apocrine glands in your genital area, and that can add a slightly sweaty or musky note to what you're already experiencing. Periods and stress tend to go hand in hand for a lot of people, so this one is worth knowing about. Your diet can even play a role. Strong foods like garlic, onions, or fish can subtly affect your body's odors, including down there. It's not dramatic, but it's worth knowing. And your choice of period product genuinely affects what you smell. Pads and period underwear expose blood to more air, which can make smells more noticeable. Tampons trap blood internally, which can reduce smell initially, but if left in too long, can make it significantly worse. Menstrual cups collect blood without absorbing it, and many people find they experience less odor with cups. There's no single right answer. The best product is whatever works for you. But if smell is a concern, changing products more frequently can make a real difference. Now let's talk about hygiene. Because there are some really common myths here that can actually make things worse. The most important hygiene habit during your period is simply changing your products regularly, every 4 to 6 hours for tampons and pads, and never leaving a tampon in for more than 8 hours. That alone handles most odor concerns. Regular washing with warm water on the outside of the vaginal area is also all you need. Your vagina is self-cleaning. It does not need soaps, perfumed washes, wipes, or douches. In fact, using scented products or douching can strip away the healthy bacteria that protect you and actually increase your risk of infection. It can also mess with your pH, which would make any smell concerns worse, not better. Unscented products, breathable cotton underwear, and regular product changes are genuinely the best tools you have. And speaking of things that don't help, please skip the deodorizing sprays and scented tampons. Medical experts consistently advise against them because of irritation risk. Your period is not supposed to smell like flowers, and products that make you feel like it are selling you something you don't need. Here's what it really comes down to. Your period is going to have some kind of smell. That is biology, and it's nothing to be ashamed of. The smells that fall into the normal category are mild metallic, slightly musky or earthy, and occasionally sweet. These are all just reflections of what your body is made of and what it's doing. The smells that deserve attention are strong, rotten odors, especially if you've had a tampon in, and any persistent fishy smell paired with other symptoms. Those are your cues to check in with a healthcare provider. Learning to know your own body is genuinely one of the most empowering things you can do for your health. When you know what's normal for you, you can actually spot when something's off. And that early awareness, that's how you stay ahead of things before they become a bigger problem. So the next time you notice a period smell and your brain starts spiraling, come back to this. Ask yourself, is it mild and metallic? Is it a bit musky because it's been a few hours? Those are normal. Change your product, drink some water, and carry on with your day. If something feels genuinely off, or the smell is strong and fishy and won't go away, that's what doctors are there for. No embarrassment needed. If you found this helpful and want more videos covering the real stuff about reproductive and body health, the questions you've always had but weren't sure where to ask, go ahead and subscribe. I'm here to answer these questions because everyone deserves to understand their own body. Thanks for watching, and I'll see you in the next video.